Hi, this is Dr. Kimberley Linert, and you're listening to Incredible Life Creator Podcast. My guest today is Dr. Sneha Gazi. Dr. Sneha Gazi's passion is to improve people's quality of life by decreasing bodily pain and dysfunction. As a professional dancer and certified yoga teacher, her passion for movement led her to the work she currently does, helping hundreds of people every year overcome their pain and improve their function. She is the owner and CEO of Sneha Physical Therapy and currently serves the greater New York area with home-based PT services. She is a graduate of Columbia University's Doctor of Physical Therapy program. She worked with New York City's leading Broadway artists and across the world with New Zealand sports teams. Her specialties include performing arts, TMJ, and pelvic health. She specifically enjoys treating women with pre- and postpartum issues such as incontinence, scar adhesions, diastasis, recti, and pelvic pain. Welcome to the podcast, Dr. Sneha.
Thank you so much for having me, Kimberly.
Yeah, so just so people can get to know you, why don't you tell us where you grew up, how you started out, and how you got to be doing what you're doing now?
Sure. So, all in a quick nutshell. So I was raised by Indian American parents in the suburbs of Maryland. Grew up there. My mother is an Indian classical dance teacher, specifically in the classical dance form called Bharatanatyam. So my childhood was completely filled with dancing and cultural, wonderful cultural things, really. My parents are both Hindu and so am I, and we grew up in a very Indian American Hindu household, which was very unique for my neighborhood at the time. I mean, right now the suburbs of Maryland are filled with Indian Americans and is way more diverse. But at the time growing up, we were, one of the first people who immigrated. So I was, a person of color in my classroom, usually the only one most of the time. But yeah, so I grew up there, went to elementary school, middle school, high school, and then I was always interested in wanting to do something related to media and arts. So, I always wanted to just be a professional dancer, but I realized I also needed to go to school and, have like a degree and all that stuff. So I was thinking, what do I do? I love writing, I love reading, I love traveling. And so I decided I wanted to be a journalist and I wanted to sort of travel the world and do talk shows and interview people and, really just be out there engaging with the public and being on camera because I just loved doing that. So I moved to New York City when I was 18 years old, and I went to NYU and decided to major in journalism. And I remember taking my first journalism class, and it was a beautifully designed class because it had every week there was basically a lecture on a field of journalism. So it was like, investigative journalism, politics, sports, arts, music journalism, travel. There were so many different fields. And then so we would learn from the professor about that field of journalism. And then the second lecture, each small group of students actually conducted an interview like journalists to somebody who was in that field in New York City or anywhere. And they would come into our class and we would set up the whole booth and then we would interview them and the class would watch. So it was a great learning experience, but I realized after going through the whole class that in order to get to where I wanted to be, there were too many layers that I was not interested in to get me to a place where I could actually do the meaningful work that I wanted to do. And, in my brain, I was like, all of a sudden, as soon as I graduated, I was going to be like, somewhere in sub-Saharan Africa or somewhere in the slums in India and like really bringing meaning into the world and, awareness into, people's lives, but that was not going to be the case. So I decided that wasn't the place for me. And then I switched my major to psychology and I studied developmental psychology. And at the same time, I was doing pre-med courses and doing a dance minor as well, just for fun. So there was a point somewhere during like my third year, I want to say, where it was like, am I going to pursue research in psychology? Am I going to med school or am I doing something else? And I remember looking at research and psychology, and that's all I did throughout my time at NYU. I was always in the lab. I was in doing research and motor development for infants. Always on the computer doing SPSS, like pumping out numbers, and I hated it. I was like, I loved conducting the studies and being in front of the babies and interacting with the subjects and the participants in the study. But that was like 1% of what researchers do. All of the rest of it happens in the background, and I just didn't like it at all. And I was like, I can't sit in front of a computer in my life. I can't do that, for that being my main job. So it was really like between med school and something else. And I really talked to a lot of doctor friends and family members and got a sense of the profession. And I realized, like, if I was going to be a doctor, I would be a brain surgeon, and I would just go all the way. It was like all or nothing for me. But in order to have that lifestyle, it would require me to compromise most of the other things that I wanted to do. And I remember there were a few dancers in my community in Maryland that I looked up to who ended up going to med school, and they couldn't dance anymore because of just the toll that the field and the profession took on them. So yeah, so I just, I looked into it more, and then physical therapy just was so amazing. And I felt that that was my calling, and it's all about movement and function and quality of life. And as a dancer, I mean, I never had physical therapy before I got into PT school. Most people are like, oh, I sprained my ankle, and then I went to PT, and when I was in high school for a soccer, injury, and then I loved what they did, so I became a PT. I never became a PT because I was a patient. I just became it because I realized how much I love movement and how much I like the flexibility of being able to do all the things. So that's kind of what brought me here. And then I went to Columbia University for PT school for a 3-year doctorate, worked at a couple places, and then quickly started my own business. And so here I am.
Beautiful. Well, it sounds like you just went on a journey when it came to actually finding your purpose and your passion. And I think that's really important for people to hear that, because so many people see someone who is successful and they say, well, I'm never going to get there. How did they get there? Well, they don't understand there's a lot of turns and curves, and just to find out what it is that you want. But once you find that, it feels so comfortable. It feels right.
Exactly.
Yeah. So talk about your Indian dance. So you said your mom was a teacher and you grew up with that. So I didn't grow up in that community. So I would like to know, what kind of dancing are you doing? Just explain the meaning behind it.
Absolutely, I'd love to. So basically, Indian classical dance, if there was a comparison to the Western world, it's almost like the ballet of Western world, whereas Indian folk dance or Bollywood dancing is more so like hip hop, street dancing, maybe modern dancing, where it's not as classically formulated. So there are 7 different main Indian classical dance forms, and a lot of them have some interconnections between each other, but they really come from geographical locations in India. So for example, Bharatanatyam, which is the one that I am most specialized in. I can do many of the other ones, but the one that I'm most specialized in, the one that my mother teaches, is from South India, around the area of Tamil Nadu, which is where my family comes from. And then, if you're thinking about Odissi, which is another dance style, it comes from Orissa, which is in a little bit further north. So basically, different areas of India kind of came across these Indian classical dance styles, formulated them, sort of codified them, and made them into like structured formats, similar to how you would think about like ballet, where there's very specific, there's first position plie, releve. There's like words and descriptions for different movements and a kind of a structure of how it goes forward. So being an Indian classical dancer, specifically, there's so much culture and religion and just so much learning that happens, because similar to ballet, you start off learning these kind of steps that have no meaning. They're just sort of movements and steps and footwork and handwork and, rhythmic combinations. And then you graduate, after you do that, you graduate into learning little dance pieces. And when you start off, they're combinations of those sequences, just like you would do across the ballet floor. And then you learn these more larger pieces that have something called abhinaya, which is expressions. And so it's all about storytelling and incorporating the dance into telling a story about something. Usually in Bharatanatyam, it's about Hinduism, so the mythology of the Hindu gods. Kind of like if you were to imagine a ballet dancer kind of telling the story of Black Swan or whatever, you know, or like the Odyssey, and they were to take a story from Odysseus doing something, and it was like a big epic something that happened, and then they kind of did the dance and the music and everything to cater to that story. So it's very similar to that in a way. So you learn so much. You learn about the religion, you learn about the culture, you learn about all these stories. And so my mom is so great at that. I think she's literally the best dance teacher ever, because she will sit there, and I see her doing it even now to these little 5-year-olds, or she'll sit there and be like, you know, this is what happened, you know, Lord Krishna did this, and this posture with your hand means this. And then they're like wide-eyed, bushy-tailed, listening to her and learning. So that was my childhood. I mean, the basement of my parents' house is the dance studio. So dance and life were very like intertwined for me, coming down to the dance studio and to the basement and doing a recital, or, you know, doing a rehearsal. It was such a part of our life. I mean, there were times where my mom would be running late, picking us up from school, and the dance students would have already arrived, and my dad would come down and be like, all right, guys, I play the music. I want you guys to do a warm up and practice. So it was just like our life. My dad and my brother are the biggest Bharatanatyam dancer critics, because they've seen it all their life too. So they can always, when we're doing like a big competition, or, you know, all the times my mom would take us, you know, to another state to do a recital, my dad and my brother would come, they could easily point out, you know, this girl's a really good dancer. I like this girl's expression. This girl's footwork is really good. So, so yeah, that's pretty much like what it is. And, you know, you do at a certain point, just like you graduate from high school or college, there's a graduation recital. It's called the Arangetram in Bharatanatyam. It's called like Ranga Pravesham in Kuchipudi, which is another style. They're different names. But it's basically when the dancer, for the first time, will do a solo debut performance, usually like 2 or 3 hours actually. And so I did that when I was 13 in India. Wonderful experience, very hard. I was crying in the middle of the performance because there was no AC. And my mom decided to put real flowers in my hair. So I was this little twig 13-year-old, and the flowers would like go like this in the middle of me dancing, because my hair was strong enough to hold the weight of like 20 pounds of
Oh my gosh. That's funny.
Yeah. So, I mean, it's such a huge part of my life. And, you know, even now during quarantine, my mom did her school's annual day performance virtually. And so in my small apartment, I like moved all my furniture and helped me set up the camera, and I did a little virtual, just an expressive performance on the stories of Lord Krishna for like 10 minutes. And, you know, it's just a wonderful way to express myself, and such a part of who I am, and shaped me to be who I am today.
Yeah, beautiful. So along the way, as you were in that, and that was just part of your upbringing, was there any lessons you pulled from there that you actually integrated into your life now, in your work or your life?
Absolutely. I think that just the fact that I had been involved so deeply, because my mother was a dance teacher, and she was so involved in the Indian dance community and in the Indian community in general, it exposed me to so many different people. I mean, there were like every summer we would have huge recitals and big, like ballads and performances, and, you know, large venues. And so meeting all these people, being able to be super comfortable under the spotlight, putting a smile on your face and never being nervous is like, I mean, I think there was like a point where I was in high school or so, and somebody asked me, don't you ever get nervous going on stage? I'm like, actually, no, I'm actually thriving when I'm on stage. I think it made me I'm generally an introverted person, and I need my space, but being on the stage is the peak of my extroversion. And I think is just a huge part of how I run my life and my business, and being able to put myself out there and not be afraid of making mistakes. or missteps in life. I think a lot of what I learned there, I mean, I remember there was a dance competition. I was really young and I did the wrong step at the wrong time. And it was just a total disaster. And I remember coming off stage and running into the dressing room, and I started sobbing, and I said to my mom, I'm never dancing again. I'm such a terrible dancer. I'm never doing this again. And my mom just looked at me and she's like, what about literally, she has a notebook of every single performance I did, where I did it, and the date. And I think at that point I got into like 200. She's like, what about the 199 performances that you did before that were perfectly fine and you came out with a trophy? How about those, And so I think that those kinds of lessons kind of help me, where even in life and business and this and that, you make mistakes because that's the process of it, but you never quit. You just keep going and you just keep doing, because that's the point of it all. Just learn. Who cares if you made a mistake? At the end of the day, no one's going to remember that performance from, I don't even remember where it was, And then the other big lesson is also the ability to keep pushing through when it hurts. I think that was such a lesson. And I even think about that all the time, where, there are times in my life where there's a crossroad or something is really difficult. And I'm like, should I keep pushing through this or should I take a break? And I think dance taught me that, where there are times where your body just fails you and you need to take a break, but then there are times where it's all in your mind and you can do more. And the second you do it for the first time, your whole psychology changes and you're like, wow, I didn't take a break in the middle of that 15-minute routine and fall to the floor while the music was still playing and make my mom pause it. I just kept pushing through. So if I can do it once, I can do it again. There's no way that I can convince myself that I couldn't do it because I did it once. And so I think that like even now, like building my business and getting it to where it is, when I look back on it and see what I have done, I'm like, I can do this again and I can do it better and I can move forward. So all of those lessons, all the teachings that my mother gave me growing up in her journey has really just made me, in every facet of my life, become the person that I am today.
Beautiful. So do you ever think that, one day I might, you had kind of wanted to go into journalism and you said you feel comfortable on the stage. Do you ever see yourself one day doing some type of TV, video type of show? Do you think that'll be in your future?
I think so. I mean, right now, I think you know this too, but I have a podcast as well, and it's all about health and wellness. So I think that's like my way of trying to do the outlet of media in my life at the moment, because my business is it takes up so much of my time right now. But that would be something great for me, if something down the line to have an outlet where I can have people on video and on camera and talk about the things that I'm passionate about. And I'm always vacillating between having something like that be about like the journey of growing up as an Indian American, or is it all like science and health, which is, I'm like, I nerd out about both of those things. And I'm so passionate about both, but I'm also like, is there a way those two things can come together,
Very likely. Very likely. I bet you'll find a way. So yeah, and just for people to know, her podcast is Fit as a Fiddle.
Yes.
So you can find it and listen to it. So let's talk about physical therapy. So talk about the practice you're doing now. I know you were doing things physically, personally with people, but now you're doing things online. So talk about what you do and how you're doing it.
Yeah. So when I started my practice, I decided to purely do home-based services only. And I live in Manhattan. So I served Brooklyn, Bronx, Queens, and Manhattan. Literally every day I would be in at least 3 different neighborhoods, if not 10, and kind of just jumping around from home to home. And I did that because that's what my patients needed. Because if they wanted to go into a clinic, there are millions of clinics. And so the specific service that I offered was a home-based, one-on-one, personalized service where I know I've worked in places where I have to pass my patient on to an aide or an assistant, and I didn't like that. I liked to have the whole plan of care under my control and really walk the patient from point A to point B, and hold their hand and guide them through the whole process without having to kind of diversify the care that they were receiving. So I originally, before COVID happened, I completely did everything through home-based services. And then when it did, for those first 3 to 4 months, I completely switched everything to telehealth, except for maybe a few emergency cases where I did go in person, of course, mask and all the precautions, because the patient really, really needed that hands-on support.
Mm-hmm.
But the telehealth worked so surprisingly well, Kimberly. I was so surprised because PT is such a, one-on-one, hands-on, visual kind of a thing.
Mm-hmm.
And to see that when push came to shove and a patient had to figure out the manual releases that I would teach for them on their own, or have their partners help them or family members help them with like stretches or releases, or using a tennis ball or foam roller instead of my hands, they got better because they were able to do that more at home by themselves, and I would encourage them to. So it was almost like, I always say, and this was even before COVID, I would tell people the best thing you can get yourself is a TheraBand and a tennis ball.
Mm-hmm.
You have a TheraBand, you can do most of the strengthening, progressively increasing the load. And then if you have a tennis ball, you can release almost any muscle in your body if you do it the right way. And I used to call the tennis ball your personalized Sneha at home. Your tennis ball Sneha.
Mm-hmm.
And I would teach them how to use it, but they wouldn't usually, because they were relying on me to come every week to do it for them. So during COVID, it was really great to see that, I could evaluate and discharge patients all within those few weeks or months, purely virtually. And it just kind of came to show the power of self-care. But in the last, 2-ish or so months, I've switched over to a hybrid model. So some of my patients I completely see in person, some of them I completely see on telehealth, and some of them I do a little bit of both depending on the week, depending on my availability, depending on their availability, kind of reducing exposure as much as possible, but still trying to make sure that they get the care they need. So right now my schedule is nuts because I'll do like a telehealth for like the morning and then head out to see patients all over the city in the evening, or vice versa. Or sometimes I'll have to go into Brooklyn in the morning, come home and do some telehealth, and go to the Bronx in the evening. So it's kind of crazy and all over the place, but I just wouldn't have it any other way. I love my patients so much. I love what I do. I love when they say they're getting better, and when a light bulb goes off in their head and they're like, I finally get something. Or just yesterday, or was it Monday? I was treating a mom and I was showing her how to pick up her baby off of the floor. And I had already showed this to her 2 sessions ago, and we reviewed it the previous session. But something about Monday's session, a cue of me like holding her hips in a specific way, or what I said, just a light bulb went off in her head. And she was like, oh my God, I get it. I figured it out now. I understand what you're trying to tell me about firing up this muscle or that. I'm like, yes, thank you. Sometimes it just takes time, but that's also the power of the in-person. There's so much benefit to that too in a certain way, but it's also great to see that both work.
That is. And then in your bio it says that you are working with people, like, do you work with dancers in New York? How is that different than working with someone who, let's say, I don't know, broke a bone or had an injury, compared to someone who's on the stage?
Yeah, so the treatment is very similar, but the personality is different in a lot of ways, and the reason and the time frame is very different. So for example, obviously right now Broadway shut down, performing arts is shut down, so they're not really going back into anything, and we need to get back quickly. But on a typical average year that's not with COVID, when a dancer gets injured, there's a lot of stigma on, if I stay injured, then I'm going to lose my part, I'm going to lose my job, I'm going to lose my role. It's almost seen as a sign of weakness, or a sign of, you just didn't make it, so you're going to get cut. And so there's a lot of fear that comes in with that. And so just like in the sports field, when football players get concussions, there's this whole problem. They're really targeting concussion management much better in the recent years with the research. Even Will Smith's movie helped a lot, I think, about concussion management. But in general, there's this push to go back into sport, back onto the stage, back into play as quickly as possible, but the body needs time to heal. So having to have that conversation of, this is a time frame, this is a natural time frame for healing. You may heal a little quicker, you may heal a little bit slower. But at the end of the day, putting yourself back at risk is going to be a a challenge and might take a toll on you, because re-injuring an injured body part takes much longer to heal than if you just injured it the first time around, right? So those conversations are different, but the treatment is still the same, you know, whether it's a dancer. I mean, body compositions are very different for different people. I know non-dancers that are very, very, very flexible, you know, they may even have a connective tissue disorder, or have hypermobility. And then I would know a dancer who's very stiff and immobile. You know, it's not always that dancers are more flexible or have a certain body type. Dancers come in all shapes and sizes, just like the regular population. But it's really just that like conversation and understanding expectations and timeframes and what is the patient's goal, because their goal might be, okay, I know it takes us long to get better, but how can we expedite this? And so I will help them. We'll do it as quickly as possible. We'll try to brace and strap and do this and that. But at the end of the day, the body has to take the time to heal, you know?
Yeah. And then the other thing that's actually I'm personally interested in is you specialize in pelvic health, and I know I've had issues with my hips being out of alignment for many years. Just started after a car accident, way before I even had children, but as I got older and went into doing CrossFit and some different things, it started creeping up on me again, where things are, the heavier I went with the weights, the more it would want to go out of place. So talk about pelvic health and how do we keep that healthy and good and working?
Yeah, so there are so many things within the pelvic health field. So first thing I'll say is, as a pelvic health physical therapist or a pelvic floor physical therapist, I am first and foremost a physical therapist. So I treat the entire body head to toe, all of the musculoskeletal parts of your body, neuromuscular parts of your body. I'm not a cardiopulm PT, although I have had patients who have had a cardiopulmonary issue, and so I've kind of co-treated those things, but I don't primarily work with that. I work very orthopedically. So as an orthopedic physical therapist, first and foremost, being a pelvic health physical therapist just adds an element that general orthopedic physical therapist may not look into the way that a pelvic health physical therapist will look into. So what that means is, so if you think about, if you go in for a shoulder injury, for whatever reason, the rotator cuff is torn or whatever the case is, and you go into a PT clinic and the physical therapist is evaluating you. What we're taught is that you always evaluate the joint above and the joint below the problem area, because everything is connected and there's always going to be some trickle down or trickle up of you have to look at the whole picture, because no joint, no muscle is isolated, it's connected to the whole system. So for example, somebody who might have foot pain might be coming from their knee or their hip. Someone who might have knee pain may be coming from their hip or their spine. So similarly, when it comes to pain in the low back, the hips, the pelvic floor, the knees, all of that stuff relates to the pelvic floor and the pelvis in general, because that's where the movement is coming from. It's a very centralized part of your body. So as a pelvic health physical therapist, I just include a place that seems to be excluded by general population of PTs, and they tend to refer it out to us because it's an intimate area. Sometimes it involves, an internal evaluation. It relates to bowel, bladder, and sexual function, which some people might not feel comfortable treating. So as a pelvic PT, I just include that in everything else that I do. So just like I gave you the example with the shoulder, the neck, and the elbow, when somebody comes into me with back pain or hip pain, the joint that's just literally right inches and centimeters away from that is the pelvis and the pelvic floor muscles, pelvic floor ligaments, the pelvic nerves and blood vessels, right? So all of that needs to be taken into consideration. And if not, you're missing a huge part of the puzzle. And you might be treating one thing and someone may not be getting better, or maybe there's a temporary fix, but the problem is really somewhere else. So in the pelvic, health field as a PT, I treat so many different things. Like I said, just now, like the hips and the back and all that stuff. But it's also, like I said, relating to bowel, bladder, and sexual function. So as a pelvic, and a lot of people don't know that PTs can treat things like this, but my most common diagnoses that I treat are urinary incontinence, constipation, chronic pelvic pain. When people have a diagnosis of having a UTI, but it's not a UTI, they've gotten misdiagnosed for years and are constantly put on, antibiotics, and they end up just getting worse and worse and worse, that is actually a pelvic floor issue.
Mm-hmm.
So, having someone go see a pelvic PT first when the UTI is negative, when the bacterial infection has been proven to be negative, is so important. So I treat that. I treat all sorts of things, including the sciatica pain, the low back pain, pelvic or hip malalignment. I treat a lot of pregnancy and postpartum issues, like, for example, diastasis recti, which is when the abdominal muscle at the front elongates and the line in between your six-pack muscles separates during pregnancy. I treat pubic symphysis dysfunction. So, and this can happen, all of these things can happen outside of pregnancy and postpartum as well. But it's when the pubic bone, the two parts of it kind of might shift in place or have a lot of pain in that intersection or on either side of the pubic bone because of the pressure. I treat pain with intercourse or intimacy, which can often happen postpartum as well. It's not always. I would say about 50% of my patients before, having a baby in the first place, or even before they're sexually active when it comes to inserting a tampon. So all of that is pelvic floor dysfunction. So things like vulvodynia, vestibulitis, all these diagnoses fall under diagnoses that pelvic floor PTs are licensed and certified to treat. But that's kind of an overview. There's so much to that. I feel like when it comes to pelvic PT, I feel like you can keep talking for ages and ages. But I think it's great that it's becoming more popular now. Still not nearly enough, but it's starting to become a little bit more popular. I think because there are more female physicians and female healthcare professionals who are sort of recognizing maybe they even have these problems. So when a patient comes to them and says, hey, my down there area hurts, or I'm having issues, I'm peeing myself, is this normal? And a lot of practitioners might say, oh yeah, don't worry about that, that just happens after a baby. But it's not normal. It's common, but it's not normal. Just like back pain is common, but it's not normal.
Yeah.
You shouldn't be living in back pain. You also shouldn't be living by peeing yourself, So those are all things that I like to, PSA.
Yeah, get the word out.
Absolutely.
Exactly. So I'm going to go a little personal. What gives you the most happiness and fulfillment in your life?
Wow, great question. I think the thing that gives me the most happiness and fulfillment are the people around me. I think that I've been so blessed with family and friends and colleagues, patients, people that I interact with every single day, people like you that I get to meet online. I think it's just so wonderful. I think the people in my life make the quality of my life so much better. And something that I do every day is every night, and really throughout my day, but especially at night, is I say 3 things that I'm grateful for every night before I'm going to sleep. And invariably, one of those things is an interaction that I had with a person during that day. I'm sure that one of my things that I'll be grateful for today is doing a podcast with you. But it's just that sense of gratitude, because I think that if you have gratitude and you feel the emotion of gratitude, I think that it's almost paradoxical to also be unhappy or fearful or sad at the same time. I think that gratitude is just like a sword that kind of pushes away all of those negativity and all the negative thoughts away in any given situation. And I guess it's my personality is the type where, I don't know if this is a lack of empathy in some ways, but I'm the type of person where when I look at a situation and I see that it's a bad situation, I always compare it to someone else who might have a worse situation. And that's how I get over things. And that might be not the way that another person does it, or maybe you don't do it that way, or somebody who's listening doesn't do it that way. But that's literally how I get through my life, is by looking at my situation and putting it on a scale of 0 to 10, 10 being that a loved one just passed away, or I have been paralyzed and can't move anymore, or can't speak anymore. That would be a 10 for me. And usually every single thing that makes me feel an ounce of discomfort or any sense of negativity is usually a 1 or a 0. If I really think about it, because I'm always comparing it to a worse situation of someone who well, you know, in the last 1 hour, I just had a really bad conversation with X person. But in the last 1 hour, somewhere in the world, somebody just died or was raped or had, you know, something bad has happened or their leg was amputated or run over. And so I look at that situation, and that's the way I deal with things. And I don't know if this is the right way to do it, but I think that that's what helps me put things into perspective and makes me have fulfillment and gratitude and happiness in my own life. I think that's really, I don't know, one of the biggest things is gratitude and really just being with people and just being able to have conversations and, you know, learning from people's perspectives. And yeah, I think that's mainly it.
Yeah, that's wonderful. So I want people to be able to find you. I know you have a website, you have some nonprofit work, your podcast. Why don't you just kind of go over how they can get a hold of you and the services that you have now?
Sure. So my podcast is Fit as a Fiddle. So you can search that really anywhere you find podcasts. Spotify, Apple Music, Stitcher, all the places that, you know, podcasts are. My website is www.Sneha Physical Therapy. So it's SNEHA physicaltherapy.com. And so on the website, there's also a tab for my blogs that I write on health and wellness, and the podcast is also on the website as well. And patients who are interested, everybody gets a free 10-minute phone consultation. So there's a book consultation button right on the website. And so you can book time with me to, you know, answer your questions or learn about my services. And then my nonprofit, we haven't even talked about that. But outside of my physical therapy practice, which is really like, you know, what keeps the lights on and all that stuff, my unpaid full-time job is being the executive director and founder of Physical Therapy International Service Foundation. So it's a nonprofit 501c3, and the mission is to serve underserved communities with physical therapy resources, workshops, education, and more. So we have traveled abroad with volunteer students, PTs, and licensed PTs overseas and provided free PT and workshops to people who wouldn't have otherwise received them. And especially now due to COVID, we've been doing a lot of virtual offerings in and around the country. And you know, everything is done by volunteer support. We currently don't have any funding, but everything is done by passionate volunteers and wonderful human beings who literally just donate their time to offer services to people who really need it and can't get it for any reason, literally any reason. Especially with the Black Lives Matter movement, that's been you know, much more of a focus around this time. We've been working with a couple of Black-led organizations and offering healthcare solutions for the inequalities in those communities. And so we offer all sorts of things, but you can check us out. And if you'd like to donate or volunteer, if you're a PT, you can check us out at pt-is.online, or you can email us at pt.internationalservice@gmail.com too, if you're interested in learning more. But that's sort of what I do at all hours outside of treating patients.
Beautiful. Well, thank you. And thank you so much for being on the podcast and for sharing all your information. I learned a lot about the Indian culture today that I didn't know, and about dance. So that was very interesting. Thank you so much.
Of course, Kimberly. It was my pleasure. Thank you for having me.
Yeah. So I have one last question before we get off today. What is your best advice on living an incredible, amazing life?
I think that the best advice for living an incredible life is to be happy now. That's an unconditional happiness that does not depend on anything, on any person, any accomplishment, any activity, anything. Shouldn't be conditional, and to just look at your life right now in every moment. And I think that kind of combines with the gratefulness that I was talking about, because gratefulness and happiness doesn't mean that you are satisfied and you don't have a goal or a mission or a purpose and moving forward and developing yourself. It means that through that whole journey of development, growth, learning, mistakes, terrible things, awesome things, that every part of that process, you just stay happy. and that you stay grateful and that you stay connected. And so there's so many things with meditation and mindfulness and having a personal breathing practice and having a personal gratitude practice, having a journal, spiritual practice where you're praying to whoever, whatever being, if you believe in that. I think all of those things help you just look at this moment and just say, no matter what is happening in my life right now, the fact that I'm breathing and that I'm alive right now is enough. And I think that's what it's all about.
That's beautiful. Well, thank you so much, Sneha, and we'll talk to you again soon.
Thank you. Take care.